Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. On today's episode of Face to Facts, we're going to be talking about the deep neck space and why this matters to you if you're thinking about doing any kind of surgery on your neck. So, colloquially, we've all heard this term, neck liposuction. Well, what does that even mean, and why is that not always a treatment of choice? So, in your neck, specifically in this space, which is called the submental, which is usually the place where people are very bothered by this double chin. You have first your skin, which is skin. Then right under your skin, you have a layer of subcutaneous, meaning below the skin, fat. Then under that layer of fat, you have this big neck muscle that is like a sheet here that's called the platysma muscle. That is what pops out when you go like this. So that's what this is, and it's what causes the vertical bands that you can see in some people as they age. So everything that is above the platysma, meaning that subcutaneous layer of fat, is stuff that can be treated with Kybella or traditional liposuction techniques. However, there is a whole bunch of other goodies that exist below the platysma that cannot be accessed by those techniques. Some of those things will include some lymph nodes and some more fat, which we call deep neck fat. Then you also have a whole bunch of different muscles that live here, such as the digastric muscles, the mylohyoid, a bunch of other muscles that live right around here that impact your tongue. And then you also have some submandibular glands that live right here as well. So there are a bunch of other things that live here that can cause some fullness in your neck. And so if all you get is Kybella or neck liposuction, you feel like there is still some fullness here, maybe it's because of one of these deeper neck structures that need to be addressed. So when patients come to me and they say, Doc, I don't like my double chin, or I want to get my jawline better, and especially if they tell me that they have tried things like CoolSculpting or Kybella in the past and it did not work for them or it did not work enough for them, what I think is, maybe it's something more than just the sub-Q neck fat. Maybe it's something deeper. And so in that situation, what we start to talk about then is doing what's called either a deep neck lift, a submentoplasty, an internal neck lift. There's a whole bunch of different cutesy terms that people use for it out there. But what that involves is you're now going below the platysma level, and you're actually dealing with some of these various things that live down there. Usually in order to do that, you do need to make a bigger incision. So your incision usually might be about this biggish or so. Will be behind your chin, and through here, we can really contour and sculpt everything in here. That means that subcutaneous fat that you could do traditional lipo on, you can play with the muscle, you can play with the lymph nodes and the fat below the muscle, you can play with more muscles below the muscle, you can play with the glands. All of those things can be sculpted down even further to give you kind of that really tight, crisp jawline and neckline that everyone is looking for. But it does mean a more open procedure. So I hope that helps some of you guys out there, especially if you have been thinking about doing anything to work on improving your neck. Again, my name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Hope you learned something on today's Face to Facts. We will see you guys next time.